Hi, so the subject that I decided to do my presentation on was a health education plan to lower obesity in Birmingham, Alabama. As we know, obesity is becoming a growing problem in the United States. So it was very interesting to find out more information on how to lower the obesity rates in the United States and what has worked in other places as far as evidence-based practice. So the problem is one of the things that I found is that in 2011 and 2000 to 2014, they found that 36.7% of the U.S. population has been observed as obese. That's 1/3 of the country's population. And in this case, Birmingham, Alabama does have a high prevalence of obesity in its community. Its schools don't have an adequate physical education program. They don't have adequate meals within their cafeteria that has healthy foods. Another interesting point was that $147 billion in 2008 were the costs of people that were obese, which is $1,429, higher than someone with a normal weight. So it's becoming very costly to the United States, especially since we've become more of a socialized Medicare plan for the population. And this also contributes to the millennial goals to improve nutrition, health in both our country and across the world. So the learning needs assessment, just fix this really quick. So the learning needs assessment would first you need to determine the majority of languages that are spoken within the community. These are some of the ones that are listed that came to mind that might be there. You also, once you figure out what languages are there, you would also, or what I would do or what our group would do, is hand out readings that are grades 1 through 12 and see which ones the highest reading level within different groups that we're testing. In accordance, we would teach according to that grade level. Another thing that we will do is show video and also show pamphlets and reading material and see which is more effective as far as teaching the community. And from there, we would teach our plan in accordance to video or reading material to see which one would be more useful. We'd also create a questionnaire in accordance to their language and reading ability, just to assess and see what they already know about healthy eating and exercising. And these are the things that are listed that we would cover to see what that is, to see what we need to actually teach. So the health promotional model that was suggested, and I thought also worked very well for the situation, was the proceed and proceed model. There's two different parts to it. So the proceed portion is a social diagnosis. We'll be able to see socially what people want to do to improve both their exercise and eating habits. Once we do that, we can get a diagnosis that will clearly identify issues that influence better eating and exercise habits within the community, like what's going to influence these people to actually do these things, what they want and then what they do. And then from the proceed portion, it's going to take both of those diagnoses and we'll be able to figure out what is keeping them from doing those things. So it's going to come off from a motivational standpoint, what they can do to better themselves, what things are holding them back, and basically change those barriers so that they can create a better lifestyle for themselves that's more healthy and more active. So the education, looks like this is covering this a little bit. There we go. So we're going to teach the benefits of eating healthy, exercising every day, and proper foods such as fruits, vegetables, lean meats, and whole grains. Also teach what foods are not healthy, to them. And also what healthy foods are available to them that are in their communities that are cost effective. We also need to teach the benefits of eating healthy and also exercising every day. We're going to educate them about plans in schools that are already in place with healthy eating, ways that we can meet the quote unquote plate analysis of having fruits, vegetables, proteins, and whole grains within their food cafeterias. They're also going to teach that we need to have 1 hour of physical activity every day in the schools, how other schools have done it, how their curriculum works, so that they will know how to implement these things into their schools and also into their communities. Another thing that we'll teach, and that was also mentioned from the research, is that you can provide, walkways, bike paths, and the city can basically make those paths more safe for the kids to walk and ride their bikes to school. In doing so, they will exercise every day. Also, from the evidence-based research, it had showed that revamping parks and community centers to make physical activity more accessible to the community lowered obesity levels as well. So these are things that we are going to teach. So the goal of the education plan is to increase the physical activity of the people within the community, and to have them eat more healthy and eliminate those foods that make them obese, because the whole point of this is to reduce obesity levels within the school system and within the community. So 3 behavior outcomes that we would be looking for, that's what actually be happening, is that they're exercising a minimum of a half hour every day, that these curriculums are being put into place by their schools. The leaders of the communities are actually making plans to revamp the community, to make schools and parks more accessible to physical activity, to opening schools longer for physical activity, and then also to have access to the My Plate criteria found. It's the letsmove.gov. It's the website that Michelle Obama put into place to eat healthy. And if they are following these things, they would be able to become less obese. The research and or evidence. So the first article is one that was done in the province of Alberta, Canada. They showed that by implementing strong physical activity programs as well as healthy food options, they decreased the rates of obesity within the community. So we've implemented that within the teaching plan so that will happen. The next one is the substance and source of young children's healthy eating and physical activity knowledge. This was an article put in place and was implemented where they taught children how to eat healthy and how to exercise. And this caused them to choose better foods and to actually exercise more. And it did have influence in reducing the obesity levels. And that was also a part of the teaching plan. The next one is the parks. It's from Parks and Recreation. It's about the city of San Antonio, Texas, making their parks and community centers more accessible to the to the population of the city. And as they did this, they did find that people went outside more and were exercising more, and basically became less obese within that city after they did that. The last one is the letsmove.gov website created by Michelle Obama. Is to create a healthier America, and then we have the My Plate link to show how they can eat better and how they can implement this excuse me, into the education plan. So for evaluation, to see that this is working, again, this kind of, you see the picture there, hopefully. Anyway, so we would need to see written policies for changes in the school curriculum to include 1 hour of a scheduled class period of physical activity K through 12 in the school district. We would need to see written government policies that are going to be implemented and within the cafeterias with the school board that will eliminate high-calorie food and start adding healthy food options to the children so they eat better. They also need to have city policies in place that will restore the city's playgrounds, parks, and recreation centers and biking routes to school, so that they'll be able to go outside and have actual places to exercise and be outside and be more active. We also would provide a survey to the children in the schools to see if what we taught sunk in, to see if they actually now know what healthy foods to eat and how much they should exercise a day and what kind of physical activities to have access to decrease their obesity levels and understand what will happen if they remain obese in their lives. So the conclusion is that more than 1/3 of the United States is obese. There are more options now than ever to choose to have poor eating habits. There's lots of processed foods, lots of fast food chains. and to live a sedentary lifestyle. There's lots of Netflix, lots of TV, lots of video games that would cause you to be still. But at the same time, there's also much more opportunity than there ever has been to eat healthy and to live a healthy lifestyle. There's internet. There's ways to get healthy foods by internet if you don't have access to it in your community. There's ways of getting it very cheaply. There's chat rooms and groups of people that go and exercise that you can be a part of. So if you really choose to want to change your life, there's many, many more opportunities and many doors open to do so. To go forward, we'll just have to educate the populations about the effects of not exercising and eating an unhealthy diet, and include the benefits of it both to the populations and the community leaders so that they can support all these efforts within the community. And then resources like www.letsmove.gov and the local healthcare providers, they will teach you how to live healthy. That's what the website was for, and we have government programs and suggestions to do that. So the references, are the life course implement of the school-based promotion of healthy living, which was already talked about, the letsmove.gov website, and then the parks received from the Parks and Recreation, and then the substance for children's healthy eating and physical activity knowledge. The other two sources, where I got a lot of the proceed model was from, this website. And the facts about the obesity levels in the United States was from www.cdc.gov. So that's my presentation, and I hope that you liked it.